related. But right now, let's go to that news conference
despite
at the CDC.
Maximal interventions, we learned today that he passed away. And our thoughts go out to his family and friends. He is a face that we associate now with Ebola. Since the start of the epidemic, 3,742 patients in West Africa have been documented to have died from the disease. We don't have their faces as prominently in front of us, and we know that even more people have been affected. So we think about this and we remember what a deadly enemy Ebola is and how important it is that we take every step possible to both protect Americans and stop the outbreak at its source in Africa. One of the things we do to protect Americans here in the United States is to improve our preparedness in our healthcare system. The three key steps are: first, thinking of the possibility of Ebola and identifying who may have the disease, so that second, they can be rapidly tested, and third, effectively isolated. That's crucial for our response. And the identification, diagnosis, and safe care of anyone who may have Ebola needs to be top of mind right now for healthcare providers throughout the country. At CDC, we do quite a bit to support healthcare workers in addressing and assessing patients. We've provided detailed information that should be available to every frontline healthcare worker about how to address a patient who may have Ebola. Anyone with fever should be asked if they have been in West Africa, specifically Guinea, Sierra Leone, and Liberia, in the past 21 days, and if so, rapidly isolated, fully assessed, and if appropriate, tested for Ebola. We provide something called health alert networks, which reach hundreds of thousands of healthcare workers. We do webinars. We reach out to professional associations, hospitals, emergency department associations, medical associations, and many others, so that we can ensure that the available information is up to date and useful. Right now, the bottom line of what we're talking about today is that we're stepping up protection for people coming into this country and for Americans related to travel. We will continuously look at ways that we can increase the safety of Americans, and we do that at many different levels. We do that in Dallas, where officials there are working intensively to monitor every person who might have had contact with the index patient to ensure that if they do develop fever, they're immediately isolated and the chain of transmission can be broken. We do that in our healthcare system with the kind of outreach I've described, so that patients will be rapidly diagnosed and, if found to have Ebola, rapidly and effectively isolated. We do that at the source, understanding that until this outbreak is over in West Africa, whatever we do can't get the risk to zero here in the interconnected world that we live in today. And we do that through entry and travel programs, including the efforts that we undertake in West Africa, and some that will be described in more detail later in this briefing. I think before turning it over to Deputy Secretary Alejandro Mayorkas from the Department of Homeland Security, I would like to emphasize the basic principles we use when looking at interventions. We continuously evaluate ways to better protect Americans. Protecting Americans is our #1 priority. Second, we make sure that whatever we do is something that works, that we evaluate, and that we can think of ways to continuously improve. Third, we recognize that whatever we do, until the outbreak is over in West Africa, we can't get the risk to zero in this country. That's why we continue to surge the CDC response in West Africa and the whole of government U.S. response in West Africa, and in fact the international response, where we're seeing hundreds of healthcare workers, hundreds of millions of dollars, and intensive effort deployed in the 3 countries most heavily affected. And finally, as we say in healthcare, above all, do no harm. We have to ensure that whatever we do doesn't unintentionally increase the risk that we will be at risk. Just to remind us of what happened a decade ago in the SARS outbreak. The SARS outbreak cost the world more than $40 billion, but it wasn't to control the outbreak. Those were costs from unnecessary and ineffective travel restrictions and trade changes that could have been avoided. Well, what we want to do is ensure that we don't undermine our ability to stop the outbreak at its source and unintentionally increase our risk here. So to outline some of the new measures being taken and review some of the measures that are already taken, I'll turn it over now to Deputy Secretary Mayorkas.
Thank you very much, Dr. Frieden. The Department of Homeland Security is focused on protecting the air traveling public and is taking steps to ensure that passengers with communicable diseases like Ebola are screened, isolated, and quickly and safely referred to medical personnel. We have implemented a range of measures to ensure a layered approach. To date, the existing measures in place include issuing do not board orders to airlines if CDC and the Department of State determine a passenger is a risk to the traveling public. 2, providing information and guidance about Ebola to the airlines. 3, posting notices at airports to raise awareness about Ebola. And 4th, providing a health notice, commonly referred to as a tear sheet, to travelers entering the United States that have traveled from or transited through the affected countries, with information and instructions should there be concern of possible infection. We are we have announced today enhanced measures. Specifically, the enhanced screening will consist of targeted questions, temperature checks, and collection of contact information of travelers from the 3 affected countries entering the United States at 5 airports: JFK, Newark, Dulles, Chicago O'Hare, and Atlanta. Customs and Border Protection officers, by way of background, the CBP officers observe all passengers for overt signs of illnesses through visual observation and questioning as appropriate for those entering the United States at all ports of entry. In addition, moving forward, all travelers arriving to the 5 airports I identified in the United States from Liberia, Sierra Leone, and Guinea will undergo the enhanced screening measures. They will answer targeted questions about whether they have had contact with Ebola patients. We will collect additional U.S.-based contact information should CDC need to contact them. And finally, we will take their temperature with a non-contact thermometer, which can be a key indicator of potential infection. We are taking these additional measures in a dynamic environment to ensure a layered approach and that we take the security measures that we assess to be needed right now. With that, Dr. Frieden, I'll turn it back.
Thank you. And before opening for questions, I would just recap that starting at JFK on Saturday and at the 4 other airports that were mentioned in the following week, and that was Dulles, Newark, Chicago, and Atlanta, these 5 airports represent about 94, nearly 95% of all of the 150 travelers per day who arrive from these 3 countries. The Department of Homeland Security, CBP, Customs and Border Protection will be implementing a new detailed questionnaire, as well as a temperature taking and providing information to each traveler. If any travelers are found to either have a fever or have a history of contact with Ebola, then the on-site Centers for Disease Control and Prevention public health officer will further interview that individual, assess the individual, and take additional action as appropriate. Now, I want to really emphasize that this is stepping up protection. It's going to find people with fever or contact who don't have Ebola. In fact, we know that over the past couple of months, about 1 out of every 500 travelers boarding a plane in West Africa has had a fever. Most of those had malaria. None of those, as far as we know, have been diagnosed with Ebola. So we expect to see some patients with fever, and that will cause some obvious and understandable concern at the airports. I would like to spend a minute just talking about malaria.
All right.
Because
we're going to step out of this right now, but you've been listening to Dr. Tom Frieden. He is the director of the Centers for Disease Control, discussing the Ebola situation. Of course, we learned this morning the sad news that first patient here in the U.S. in Dallas has passed away from Ebola, and now the discussion continues about protecting everyone else in this country.
Yeah, and the CDC listing 5 major airports that are outlets for a lot of flights from West Africa, where passengers will undergo real scrutiny, not just questions, but also non-contact thermometers as your temperatures are taken. Any signs of Ebola clearly will be taken very seriously. Pentagon and the White House also showing the level of severity with which they're taking this situation. So,
all right, we'll continue to follow this, of course, throughout the evening, but